In medical affairs, particularly for medical science liaisons, MSLs, strategic engagement with key opinion leaders, KOLs, is at the heart of our work. These interactions are not simply about building relationships. They are about gathering valuable insights that can drive scientific discourse, inform product development, and ultimately improve patient outcomes. However, achieving this requires more than just casual conversations. MSLs need to master the art of asking the right probing questions and understanding the importance of documenting the data, facts, and observations that come from each engagement. In this tutorial, we will guide you through two critical aspects of effective KOL engagement. First, we'll dive into the different types of probing questions, exploring how each type can be aligned with specific engagement objectives and overall organizational strategy. You'll learn how to craft questions that open up deeper conversations, uncover new insights, and ensure that each interaction is meaningful. Next, we will focus on how to document the essential elements of KOL engagements: data, facts, and observations. We will discuss their importance, provide examples of each, and offer recommendations for what to do after an engagement to ensure that the gathered insights are effectively captured and ready for analysis. By the end of this tutorial, you will have a deeper understanding of how to maximize the impact of your KOL engagements, making each interaction a strategic advantage for your role and your organization. Now let's start by the types of probing questions and their strategic importance. Probing questions are essential tools for MSLs during KOL engagements, enabling deeper conversations that reveal valuable insights. The type of probing questions used should align with the engagement's objectives and the broader organizational strategy. By asking the right questions, MSLs can guide discussions in a way that gathers targeted information, helping to shape medical and business strategies. Here, we'll explore different types of probing questions and provide examples of how they can be used to align with the objectives of a KOL engagement. 1. Clarifying questions. These questions help to ensure that both parties understand the subject or viewpoint being discussed. They are useful when an MSL needs to gain a clearer picture of a KOL's perspective, or when the conversation drifts into complex or ambiguous topics. Let's have an example for these types of questions. Let's say that the objective is to understand a KOL's perspective on recent clinical data related to a new treatment. The question: can you clarify how you see this new data influencing your current treatment approach in patients with advanced cancer? This question ensures that the MSL fully grasps the KOL's view on how the clinical data aligns with real-world practices. The insights can be used to adjust messaging or create targeted educational materials for similar experts. 2. Exploratory questions. Exploratory questions are designed to open up broader topics and encourage the KOL to share their thoughts and experiences. These questions can help uncover new areas of interest or unmet needs that the MSL might not have considered initially. Example: if the objective is to identify potential unmet needs in the treatment of heart failure, then the question can be: what challenges do you see in managing heart failure patients, particularly with current treatment options? The responses to this question can reveal gaps where the company's product might fit, providing the MSL with insights that could influence future product positioning or guide the development of new clinical trial designs. 3. Comparative questions. These questions ask the KOL to compare different therapies, approaches, or outcomes. They are particularly useful for understanding the KOL's preferences, criteria for decision-making, and areas where they perceive advantages or drawbacks between options. Example: the objective here is to assess a KOL's opinion on how a new treatment compares to existing standard of care options. Question: how do you feel this new treatment compares to the current standard therapy in terms of efficacy and safety? By understanding how the KOL perceives the relative strengths and weaknesses of different treatments, MSLs can adjust their communication strategy to emphasize aspects of their product that align with the KOL's priorities. The next type of questions is the hypothetical questions. Hypothetical questions encourage the KOL to think about future scenarios or outcomes. They are effective for exploring how a KOL might respond to potential developments or changes, such as new research data or emerging guidelines. Example: objective: gauge the KOL's interest in a potential future study. Question: if data were to show that this new mechanism significantly reduced hospitalizations in heart failure patients, how do you think it would change your treatment approach? This type of question helps MSLs understand the conditions under which the KOL might adopt new therapies or change their current practices, which can be crucial for planning future studies or positioning new data. Number 5. Insight gathering questions. These questions aim to draw out specific insights about clinical practice, patient management, or the KOL's experiences. They are particularly useful for generating data that can be used internally to inform strategies or to understand the patient journey from the KOL's perspective. Example: the objective here is to gather insights into patient adherence challenges in a specific disease area. So the question can be: what are the most common reasons you see for patients struggling with adherence to their treatment regimen? The insights gathered from this question can inform patient support programs or help shape communication strategies that address these adherence challenges, ensuring that the company's messages resonate with both the KOL and the patients they serve. 6. Validating questions. Validating questions are used to confirm or test the accuracy of the information the MSL has received. They are particularly helpful when the MSL wants to ensure alignment between the KOL's perspective and the data or trends observed in the field. Example: objective: confirm a KOL's alignment with a new clinical guideline. Question: based on the new guidelines, do you find yourself changing your treatment approach, or do you feel your current practice already aligns with these recommendations? This question can help the MSL assess how new guidelines are being adopted in practice, allowing the MSL to better tailor their discussions to support or educate KOLs on aspects of the guideline that may be less understood or embraced. 7. Reflective questions. Reflective questions encourage the KOL to think deeply about their own experiences and the broader implications of their work or research. These questions often bring out rich qualitative insights and help build a deeper connection between the MSL and the KOL. Example: the objective is to understand a KOL's perspective on emerging trends in their field of expertise. Question: looking back over the last few years, what do you think has been the most significant shift in the way we manage chronic disease? Reflective responses can help MSLs understand long-term trends and how a KOL's perspective might influence future research or clinical practice. This can help MSLs position their organization's efforts in a way that aligns with the evolving needs of the field. Now, let's talk about data, facts, and observations, and how to capture and document them. First, data. And data is quantifiable information that refers to measurable, quantitative information collected during a KOL engagement. It often includes numerical values or specific metrics that can be analyzed to identify trends or patterns. Data is critical for creating evidence-based insights that can be used to support clinical decisions or shape the organization's strategic direction. Example: during a discussion with a KOL, they share the results of a recent clinical trial they conducted, showing a 25% reduction in adverse events when using a new treatment protocol. Another example could be the KOL providing patient demographics, such as age groups, disease progression stages, and response rates in their patient cohort. Value. This data can be used to better understand the effectiveness of a new therapy or compare it with existing treatments. It can also serve as a benchmark for evaluating the potential impact of the organization's products in a similar patient population. Then we have facts, which are verifiable statements. Facts are objective statements or pieces of information that can be independently verified. They often provide context or background to the broader discussion and can serve as reference points when generating insights. Facts may not always have immediate numerical value, but they help to ground discussions in reality. Example: a KOL mentions that a specific guideline from a major health organization has recently been updated to include a new therapeutic approach. Another example could be the KOL stating that their hospital has adopted a protocol that reduces patient length of stay by implementing an integrated care pathway for a specific condition. Value. Facts like these help MSLs stay informed about the latest developments in the field and ensure that their insights are grounded in the current clinical landscape. They also provide important context for discussions with internal stakeholders. And finally, observations, which are subjective insights. Observations are subjective insights gathered from the KOL's experience or perspective. These insights often reflect trends, preferences, or challenges that the KOL has noticed in their clinical practice. While observations are not always backed by hard data, they provide a window into the practical realities faced by KOLs and their patients. Example: the KOL observes that many of their patients with a chronic condition express concerns about side effects, even when those effects are mild. Another example could be the KOL noting that, in their experience, certain types of patients respond better to therapy when combined with lifestyle interventions, even though this hasn't been formally studied. Value. Observations like these can offer a nuanced understanding of patient behaviors or clinician preferences, which might not be apparent from clinical data alone. They can help identify areas for further investigation or refine messaging strategies to better address KOL and patient concerns. Recommendations for MSLs. After completing a KOL engagement. Once an engagement with a KOL is complete, the next steps are critical for ensuring that the information gathered is properly documented, organized, and ready for analysis. Here are the recommended actions for MSLs after each KOL interaction. 1. Document key takeaways. Immediately. It's essential for MSLs to document the key takeaways from each KOL engagement as soon as possible, while the information is fresh in their minds. This includes summarizing the data, facts, and observations discussed during the meeting. Data. Include any specific metrics, trial results, or numerical data shared. Facts. Record updates on clinical guidelines, newly adopted protocols, or other verifiable information. Observations. Note any trends, challenges, or subjective insights shared by the KOL, even if they lack numerical backing. 2. Categorize and tag information. Organizing the information gathered during the engagement can streamline later analysis. Use tags or categories to organize data, facts, and observations based on therapeutic area, product relevance, or strategic focus. This helps ensure that relevant insights can be easily retrieved when needed. Example: tagging a KOL's observation about patient adherence as patient behavior or adherence trends can help you easily locate this insight when the marketing or medical teams are designing patient support programs. 3. Align insights with engagement objectives. Review the initial objectives you set for the engagement and ensure that the information gathered aligns with those goals. For example, if the objective was to understand the KOL's perception of a new clinical trial, focus on highlighting their feedback related to the trial results and potential impact. Recommendation: create a section in your report that directly addresses how the engagement outcomes support or differ from the original objectives. This ensures that any deviations are noted and can be discussed with the team. 4. Identify information gaps. After documenting the engagement, assess if there are any gaps in the information collected. Were there any questions that didn't get answered? Did the KOL mention areas they'd like to explore further? Identifying these gaps early allows MSLs to prepare for follow-up engagements more effectively. Example: if a KOL mentioned a new study but didn't have the data on hand, note this as a follow-up point to revisit in the next meeting. 5. Summarize for internal stakeholders. Before moving on to deeper analysis, MSLs should create a concise summary of the engagement that can be shared with relevant internal teams, such as medical affairs, marketing, or clinical development. This summary should highlight the most critical points, potential strategic implications, and any immediate action items. Example: if a KOL highlighted the need for more patient education on a specific side effect, include this in the summary as a potential area for new educational materials or communication campaigns. 6. Record follow-up actions. Document any follow-up actions required after the engagement. This could include sending the KOL additional data, scheduling a follow-up meeting, or connecting them with internal experts for further discussions. Clear follow-up plans ensure that the momentum of the engagement is maintained and that valuable opportunities are not lost. 7. Store documentation in a centralized system. All engagement notes, summaries, and follow-up plans should be stored in a centralized system such as a CRM or a dedicated internal database. This ensures that other team members can access the information when needed, maintaining continuity and alignment across the organization. Example: a shared platform allows other MSLs or medical affairs team members to see that a specific KOL has already shared their views on a new treatment, avoiding redundant conversations. So, ladies and gentlemen, this tutorial has provided a comprehensive guide on how MSLs can optimize their KOL engagements through strategic questioning and effective documentation. By using targeted probing questions, you can guide discussions that uncover valuable data, facts, and observations, all of which are crucial for generating insights that align with organizational goals. Thank you for joining this tutorial, and we hope these strategies empower you to elevate your role and make a lasting impact in medical affairs.